is Manesh Patel. I'm chair of the scientific sessions, and I'm excited to be joined here by my vice chair, Amit Khera. Amit, thanks for joining me. This is AHA at the TCT. Welcome.
Well, very exciting to be here, Manesh, and we have lots to talk about.
Yeah, maybe we'll just start by talking about what the collaboration is between the AHA and TCT. And, this is really trying to get the best out of two amazing organizations that are, I think, very complementary. The American Heart Association has a broad width and depth in some of the scientific things they do. And obviously, TCT is a place where really in-depth clinical science around interventional and invasive therapies are done. So I think the collaboration is an aim to get diverse thought as we start to think about how we get care for our patients. Is that how you think about this collaboration?
I think you said it really well. We're thinking about education, right? And we have science, we have clinical medicine, and really the marriage of those two. And I think these two organizations coming together really help foster unique and innovative education. Again, merging that idea of science to clinical management, sort of the whole picture around healthcare and cardiovascular disease care.
And some of the joint AHA TCT sessions sort of speak to that. Maybe we'll go through a few of those and people get a sense of that. Yesterday, there was an innovation session that we actually have one of our hot takes on that people will be able to see also. It was an innovation in how we're going to get closer to patients and help with their care. And there we had Mariel Jessup, our chief medical and scientific officer from the AHA, talking about where we can get and how we get closer to patients. Clyde Yancey, one of our past AHA presidents, talked a little bit about what we're doing with innovation and health equity, meeting patients where they are. Rob Califf, the FDA director, was there talking about the data streams. TCT represents Juan Granada and others were there. Peter Fitzgerald talking about where's the world of innovation going and what are some of those things. That session kind of encapsulates what I think is going to be part of this collaboration. How do we take innovation and also think about how we improve health, and how do we do those together? What are some sessions that you can think of that have done that?
You and I participated in a really fun session today, which was one on clinical cases and looking at revascularization, some complicated areas, patients with multivessel coronary disease, depressed ejection fractions, and one on microvascular angina. And I think what's important is those sessions were really about guidelines. We had Jacqueline Thomas-Holland, who's vice chair of the revascularization guidelines. We also had some folks from the chest pain guidelines. And so what was really great is that we got to think about the cases and the technical aspects of the revascularization, but we got to step back and talk about shared decision making. Who should we revascularize? Even some prevention. Also, thinking about where do the guidelines come in. So I really love that sort of multidisciplinary focus and really talking through the guidelines. I think you were doing something about hypertension also, which was a really interesting session.
Yeah, I think just as you said, part of this, and I'll just say at the revascularization guideline has conversation we had. Maybe the first time I've been at TCT where somebody was looking to diagnose amyloid and make sure we check the LP, little a, or LDL, and other preventive therapies, which are really important. And I guess I would say same thing happened at the hypertension session, because we have a plethora of things, a lot of invasive therapies, some late breakers here, some late breakers, in all of our meetings around what can we do invasive. But there's medicines coming too, and important studies that we just saw put in context. At ESC, we saw a study about daytime versus nighttime, the time trial of when you take blood pressure pills. And we had people from the American Heart Association and TCT, again, getting together to say, what are the medical therapy guidelines? How important is ambulatory blood pressure? When do you check? How do you check? How can you get adherence? What are mobile and chronic blood pressure programs? And then how do you put these invasive therapies in context of that, and then what's coming? So I thought that was a really, really interesting session. Any others that sort of struck your mind, Amit?
One other big area is VT, venous thromboembolism, and pulmonary embolism management. And, there's so many controversies there. And there's actually a AHA TCT called State of the Art controversies in management. And, this is really case-based, again, thinking about, your shock, your submassive PE, how does one management, again, bringing sort of emerging science. What are some of the new technologies and techniques? We certainly think about catheter-based and mechanical circulatory support, but also patient selection, biomarkers, emerging science, a little bit about COVID in some cases there too. So again, really about practical education for the clinician, but a lot of science and emerging techniques and technologies that are coming out. I think this is really bringing out the best in this collaboration. Manesh, this is we've been packaging these in something called the hot takes. Maybe you can tell us about these hot takes.
Yeah, maybe we end with that. For each of the things we're doing every day, we're trying to put together little 10 to 15 minute videos with, again, collaborators from both the American Heart Association and TCT, people that have been at both meetings, and really thinking about these joint sessions and saying, what can we tell people? And the hot takes in general sort of go over what did we hear, what did we learn, but then give the impression or the context of the experts in the field, and then end with their hot takes. What's most meaningful? What's going to happen in the future? And we'll see how they turn out, but it's an interesting way to try to get some of this information. Well, we're really excited to be able to be at TCT with the AHA, and also just to see people back in person and thinking about meetings. We look forward to seeing everyone at the American Heart Association scientific sessions in November. We know that's going to be really an exciting time where we have, again, hopefully all the things you can think of, including late-breaking science, poster presentations, but most importantly, we'll also have some sessions that are, again, joint with the TCT there. So we look forward to that. Thanks for joining me, Amit.
Thank you.